do quick introductions. I'm just going to do mine right now since I'm already talking. I'm Sarah Chamberlain, Executive Director of National PKU News. And then if you have questions while either of us are talking, if you can either raise your hand, use I think that's under reactions, or put a question in the chat, then we can sort of pause the flow, take the questions, or respond to them via chat, however works out best for us. And when you're not talking, if you can mute, that will also help us. But again, you can put any questions either privately to Lillian or I, we're both hosts, in the chat, or just raise your hand and, we're happy to have you ask them in person. It looks like we're a pretty small group. We've got about a dozen people so far. Hopefully some more people will be joining. Lily?
Yes. Hello, everybody. So I'm Lillian Isabella. I am on the board of directors for the National PKU Alliance. I think I probably know all of you already, but why not just get this out there? And I'm the chair of the Advocacy Committee. And then I also have PKU, phenylketonuria, which is a rare disorder. That is what brought me into advocacy in the first place. So yeah, we're excited to dive in. I'm honored to be co-hosting this with Sarah. Many of you know who she is as well. She's a badass. And we're gonna dive in. Advocacy equals telling your story. And like Sarah said, we have about a dozen people right now. More people might be trickling in, and that's fine. I take a moment to let them in as we go. But yeah, just keep in mind what your questions are, and we will answer all of them. All right, so the Medical Nutrition Equity Act, MNEA. Likely many of you have heard of this bill. We've been talking about it a heck of a lot, and we are working to get it passed right now, very ferociously. And I'm going to turn it over to Sarah to give the overview of what the current status is with our efforts.
All right, so as many of you know, and Lillian mentioned, we've been working on this bill. There's been some sort of medical nutrition bill in Congress for the past at least 10 years, which is so 5 congressional sessions, because each one is 2 years long. We are currently in the tail end of the second year of the 117th Congress. We're not going to talk about in length what that means. I'm going to touch on it in the last bullet point, but we've had an incredible amount of momentum and just building strength on this bill. In the 117th Congress, we currently have 116 co-sponsors, 22 in the Senate. That's 17 Democrats, 4 Republicans, and 1 independent senator, Senator Angus King of Maine. And then in the House, we have 94 co-sponsors. So that's 79 Democrats and 15 Republicans. Highlighted there, you see need more Republican co-sponsors. And we're going to talk about that a little more later on in the presentation. But the key for us is that we do want to keep this bill balanced, bipartisan. It has bipartisan co-sponsors in both the House and the Senate. It is not a political issue. This is a healthcare issue. This is about, healthcare for Americans, full stop. And so right now, we're really focusing on shoring up that Republican support and really showing everyone that it is just a healthcare issue and not based on which party you're in, because that's really important to moving the bill forward. We have a 3-pronged approach for advocacy, and this approach has been going on for a few years now. It's pretty standard, but we have the Patients and Providers for Medical Nutrition Equity, which many of you have shared your stories with and use that website to advocate through. That's a coalition of 45 organizations who support this bill. As the name suggests, it's just patients and providers. It's not industry. And that's important because we're really trying to show the sort of grassroots human impact of the bill. On that coalition is not just PKU. It's not even just inborn errors of metabolism, but there are other organizations and disorders like GI conditions, Crohn's and colitis, some food allergy, protein allergy groups. because all of us rely in these communities on medical nutrition to treat our disorders. And that's a strategic choice to approach it that way, because a lot of politicians of any party say, well, I don't support disease-specific bills. And so we're saying, well, this is not disease-specific. This is a huge group of patients, and we all happen to have the same treatment. And that's why we're asking for you to treat our treatment, no pun intended, as equal to, another medical treatment like insulin. Although it's maybe a bad week to talk about supporting bills for insulin. Because that was just taken out of the bill that was passed this past week. But to that point, it's really just about the treatment. It's not about PKU or MSUD or another, a GI condition. It's really about how we all require this treatment together. Crossroads Strategies is a Washington lobbying firm that the National PKU Alliance has worked with for a few years. And they're really doing office level engagement. That means they have lobbyists who know the politicians, the legislators, and their office staff very well. And they're working with them on a one-on-one basis to make the argument for the bill. And then we have the grassroots, and that is really the largest group and the most important group, because our legislators work for us, the grassroots, the people, in the communities across the country. And we're going to talk a little bit about, working locally and advocating locally later on. And that's because, we elect these individuals, and your story and your reasons for wanting this bill passed are the best and strongest argument for passing it. As I mentioned at the top, the time is now. We really want to get this bill passed before the end of the year. That's because we have a lot of good momentum. And also because if it doesn't pass, we will need to reintroduce it in January. Now, that isn't a huge, arduous task, because we still have many of our supporters for the bill. And the co-sponsors, 3 out of the 4 co-sponsors will likely be returning next term. So we will be able to ask them to again reintroduce the bill. All the co-sponsors that we have, it's much easier to call them up and say, listen, you supported the bill last Congress. We'd like you to do it again. The bill is the same. There's usually no reason why they would make a change. And that's why even if we don't get the bill passed this term, it's good to get more co-sponsors on. Because then in January or next term when we reintroduce, we can call and say, listen, you signed on at the end of last year, let's just re-up you. And that again just gives us more strength. Can you go to the next slide? So Lillian's going to talk about a few of the opportunities for legislative advocacy.
So Rare Across America, you can't register for that at this point, but if you already registered, you have most likely received an email with your appointments. And if you haven't yet, definitely search your inbox for an email from Advocacy Day at advocacyassociates.com. This feels like a good time to mention that at the end of this, probably within the next 24 hours, we're going to send you this slide deck. So don't worry about needing to take copious notes. We will be sending this to you afterwards so that you can have it as a reference point. But yeah, Rare Across America is kind of produced, I guess you could say, by Every Life Foundation. And they go ahead and they schedule all the meetings for you with your senators and your representatives. And those meetings started last week and they'll be going throughout August. I just met with mine this morning, and Sarah met with hers this afternoon. And it's really just an incredible opportunity to just show up. So if you happen to not have registered for Rare Across America this time round, I would recommend going to the Every Life Foundation website and searching for Rare Across America and signing up for notifications for the future, because it's truly the easiest way to meet up with your senator or your representative, because they do all the legwork for you and you just show up and share your story. Then you can also, another opportunity for advocacy is you can find and call your senator or your representative on nutritionequity.org/find-your-representatives. And this is a clickable link. When we send you the deck, you'll be able to just click this and it'll take you right there. And you'll use your talking points that we're going to help you develop during this call, and be able to speak on the phone with your senator or rep about getting them to support the Medical Nutrition Equity Act. You can also email your senator and representative, nutritionequity.org/contact Congress. We recommend, actually Crossroads, our lobbying firm, I've been working with them one-on-one, and our lobbying firm recommends that you first call your senator or your rep, and then you email them a follow-up and say, hey, we just spoke with, you'll probably speak with an intern or an aide on the phone, but that's still okay. Their whole job is to listen to you, and they are going to take it very seriously. Then you follow up with this email your senator, your representative. Nutrition Equity makes it super easy for you to do that. You just click that link, put in your address, and they will open up a form. And when you fill out that form, super important to personalize it in some way, because people respond much more to something that feels like it's coming from the heart as opposed to a formulaic email. But it's a good place to start from. And then you can request in-district meetings with your representatives and senators during the August recess. This is super important to do because August, everybody kind of leaves DC and they go back to their hometowns. And it's a really great time to get face-to-face contact with your representatives and senators. And the way you would request that is you input your information to find your representatives at the Nutrition Equity site, this bullet point right here. And then you can just, reach out, call them and say you'd like an in-district meeting or send them an email. And then we are going to go over some talking points for you, Republican talking points and Democratic talking points. So Republican talking points include allowing patients to choose treatment options that are medically appropriate for them based on their specific needs in conjunction with their physician. This next point is a particularly effective one when speaking with Republican representatives and senators. TRICARE's coverage of medical foods has already set the precedent for national coverage. So this coverage is already a thing for our military, and it should be a priority for all Americans. So then also children get this disease through no fault of their own. This disease, so I believe the majority of the people on this call are connected to the phenylketonuria PKU community, but if you're not, whatever your disease is with the Medical Nutrition Equity Act, it covers a whole host of rare diseases and disorders. And that's what the Patients and Providers for Medical Nutrition Equity is composed of, is this organization of all the allied disorders who would benefit from this being passed. But children get these diseases through no fault of their own, and it's a significant financial burden for families, which we all know personally. And then the financial strain is only worsened with the inflation and the recent pandemic. And so that's something to bring up as well. Democratic talking points. There is no national mandate for coverage for medical foods, which is sometimes the only available effective treatment for PKU. Passing this bill is an effective step towards continuing to realize the full intent of the Affordable Care Act. That second bullet point is especially powerful when you're speaking with a Democratic representative or senator. There are many state mandates for coverage, but they're disparate, not uniform. So you can move from state to state and without realizing it, lose coverage. And then self-insured plans are exempt from state mandates. And this last one, state coverage mandates are often cut off at an arbitrary age, but children don't grow out of having PKU. So like these are like kind of dry talking points, but you can personalize them with emotion. This last one, for instance, when I shared it this morning with my representative's office, I was kind of like, this doesn't make sense because treatment is for life. But then some insurance companies are like, well, at 12, then you don't need it anymore, or at 18, you don't need it anymore. It's like, who are you? You are not my doctor. So it just doesn't make sense, and it's something that shouldn't be possible. I think Sarah kind of put this in the chat, but Democratic talking points are the points that you would share when speaking with a Democratic representative or senator. And you can see like in the upper right-hand corner here, we're not currently seeking more Democratic co-sponsors. This is just the tactic that we are taking right now. We are trying to build our Republican co-sponsorship list because if it gets too out of balance with one party or the other, then it is less likely to move on to the next thing because it's gonna, it'll be harder to get more Republicans further down the line if you have a wildly disproportionate amount of Democrats and Republicans. It is already a bipartisan bill. So that is already a thing. Like Sarah said at the top of this call, this is not a political issue. It is a genuine, like just human thing that both Democrats and Republicans are on board with, and it makes sense for both parties to support. So what we're asking, and I had to do this morning actually with my Democratic representative, is to say, do you have any colleagues, any Republican colleagues who you believe might be interested in supporting this? And if so, would you be willing to reach out to them and ask them to join as a co-sponsor? And just as an anecdotal example, the person I spoke with this morning said, yes, actually, my office has friendly relationships with about 30 Republicans, and we're going to reach out to them and let them know about this bill. So had I not asked that, I would have never known that, and she never would have done that. So I think it's just about not being afraid to ask for those Republican support, whatever, even if that comes from a Democratic representative, which is possible. So I'm going to turn this over now to Sarah, because she's been a real leader in the space of media and advocacy in media with the formula shortage crisis, and she's going to just share with you how that ties in with the MNEA.
Thanks. So I think we're all aware of the formula shortage crisis. And for us, it's not a baby formula crisis, but is a general formula crisis. And I think as tragic and difficult as this has been for our community and for hundreds of thousands of families across the US, it has presented a pretty unique opportunity for our community to make the point about how important those cans of formula are. And at this point, I usually hold up a can of formula. I'm on vacation and it's downstairs. But to that point, if you are speaking either via Zoom or or in person, Lillian will talk about bringing props to demonstrate or sort of give a point to your story. And what I always use is the formula can, and I think that's really important now because everyone suddenly understands that off-white powder mixed with water is really, really important to the health of people. And that includes not just newborn babies, but I think we've actually done a pretty fair job of making people understand that it is not, that it is not just babies, that it is lifelong medical treatment for, a very large community. And so my advice on that is, start local. I'm going to call out Kayla in a minute when we start doing a discussion because she's on here and she started local talking about medical nutrition equity and really was able to blow that up in a really important way this last week. I've done the same with the formula crisis. I, approached a local newspaper in New Jersey and said, do you want to hear about why it's not just a baby formula issue? And they did a story. And then the Washington Post did a story. And, we've been able to get on CBS News and NBC News because of that. And our message is really that supply is not the same as access. This crisis is going to subside. The Abbott formula, the Abbott factory is producing metabolic formula now, and at some point our supply issues will be gone. But even when we have full supply, our community will not have access to this formula because so many of us do not have medical coverage for formula and medical foods. And so while the baby formula crisis is still hot, really using it as a wedge to talk about the fact that we are constantly in crisis because we do not have access to medical nutrition is a really effective way to get attention to this very small, rather obscure bill that we are trying to, push across the finish line. And again, when we start talking about our stories, I think Kayla will have a good example of how she made that happen. And I'd love for her to share that with you all. All right, on to telling your story.
So sharing your story is the literal most important tool that we collectively have to get the MNEA passed. Your representatives and your senators, they want to hear from you. And that's mostly all they want to hear. So it's really important for us to tell our story. And we're going to just give you some tips here on how to structure your story as you begin to, become an advocate for the MNEA, or if you continue becoming an advocate and you just want some pointers. And people like Kayla, if you guys want to share, you've been doing this for a while with some great success. And if you guys want to share, things that have worked for you, I think that would be wonderful as well. So basically, when you advocate, you are sharing the knowledge of something you live with every single day with your representatives and your senators. And I think it's so important to know and remember that they just have no idea what's going on with your rare disease or disorder. I remember the first time I spoke with my senator's office, Senator Gillibrand in New York, the legislative aide that I spoke with did not know what PKU was. And I explained it to her and she was just grateful. That was her reaction, was, thank you so much for sharing this with me. This is so interesting and I didn't know anything about this. From that first call, it took about 5 years for Senator Gillibrand's office to come on as a co-sponsor. And that was all throughout those years, myself and many other advocates met with that office and, pushed for the MNEA to get passed. So I share that because it's this telling your story is the first touch point, or maybe it's the 10th touch point that they've had, but each time they hear it and each time, they absorb it, they learn more about it. And then they're more confident the next time MNEA comes up. They'll be like, oh yeah, hey. Now I go into meetings and they're like, hey Lillian, they know who I am now, which is helpful. It's helpful because then you just become a pleasant little reminder in their ear. Squeaky wheel gets the grease, as people say. But they really need you to show up and tell that story. That's what advocacy is about, full stop. You're helping them understand why this is important and why they should pay attention. And by showing up, you're making them pay attention. So these tips on the right are kind of you can think of them as a blueprint for your storytelling. And these are kind of some good general points to hit and how to structure what you share. But you can start with your name, always a good place to start. And think of this as like an elevator pitch, right? And it might be shorter if you have a shorter amount of time with your representative or your senator. It might be longer if you have the meeting all to yourself. You can just kind of feel it out on a case-by-case basis. So I'd recommend having like a shorter version and then maybe a slightly longer one. But start out with your name and then share, where do you live? Because people love to hear from their constituents specifically, and sharing a neighborhood or like, a local spot that you might, know or go to. I always say, I'm in Manhattan and I grew up in the Bronx, because it adds like, oh, I've been a New Yorker my whole life. And then if the person I'm speaking to is also a New Yorker, they'll get excited and tuned in more. So just think of little like things that you can mention regarding your neighborhood or something local that would help facilitate a person-to-person connection with the representative or senator you're talking to. Then you want to say what your ask is. You want the senator or the representative, and then say their name, to co-sponsor the Medical Nutrition Equity Act. This is the Senate number, S-2013, and the House number is HR 3783. I want to note that if you're speaking to a senator, you only need to say the Senate number. And if you're speaking with a House representative, you only need to say the House number. And again, we're going to send this to you, so don't worry about needing to memorize this or write this down. Next point, why does this matter to you? So I think this is kind of a good point to describe your disease or your disorder. Why the Medical Nutrition Equity Act is important to you personally. And this is that touch that allows them to think about this beyond just a legislative matter. Because at the end of the day, they could read an email with all the information you're sharing. The thing that makes this impactful is that you're a human being experiencing emotions, and this is a real consequence on your life. So describing how has this treatment changed your life? And why is it so important that others get it? I'll often in this section throw in a little something like, and this is my own personal example of this, but I think as you go, you can kind of find your own way to throw a little spice into it, or, like make it your own. But for me, I'll say, if I wasn't on treatment from birth, then I would have had cognitive disability, and I maybe would have been in a assisted living facility. And contrast that with having been on diet and having had access to the formula and low protein foods. I was able to graduate with honors from college, NYU, and I work full time as a marketing and creative lead. So just something that makes them see the dramatic difference is helpful. An example someone gave on a previous call is, the monthly cost for me is as much as a mortgage. And like a mortgage is a really great example to give, because a lot of people in the government have to pay mortgages. So just something that personalizes it, makes them go, whoa, that is a big difference. And then what does the legislation accomplish? So just a quick overview. This is an example of what you could say in parentheses here. While medical foods have been used to treat PKU for more than 50 years, many insurance companies will not cover them, and the MNEA would solve this. And then this is also the point where, if you remember those Republican and Democratic talking points that we had, this is the spot to throw in one of those talking points. And then thank them for listening and ask how you can follow up with them. I kind of like to give a little space after I finish describing the legislation and my personal experience, because, like, for example, what happened today when I did that, my representative said, that they were going to support it, which is great. And so it's like, you just give it a beat and see what their emotional reaction is going to be, or if they're like, yeah, it makes no sense, or like, just let it be a human thing, human interaction, and then thank them. How can you follow up with them? And then I recommend also like setting a reminder to follow up with them in a couple of weeks as well. Sarah, anything you would add to that before we go into kind of a creative writing session, if you will?
Well, I hope maybe you're going to say, oops. Sorry, I turned off my video because I had children running in here. I hope you're going to say the term that was so popular in our last session, which was to make your story spicy.
Yes.
So that little piece that Lillian put in about her personal and where she might be without medical nutrition was what she called the spice of your story. It's that one thing that someone remembers and thinks, wow. It's that one thing that sticks in their head, and it can be, something like, my medical nutrition costs as much as mortgage, or it could be something else. I mean, it's really important that it be personal to you, but I think that term of something spicy, was really helpful for people, particularly when they were doing this drafting, to think about what really would stick in someone's mind. And so other than that, I don't have anything else. I think you've covered it all really well.
Okay, amazing. So I'm going to stop my share for a moment here. And I'm going to just have, I think everybody, if you have a pen or a paper, or if you just want to open up a Pages or Google Doc on your computer screen, we're going to give you, I actually think we can give you 10 minutes today, if that feels all right, Sarah. Yeah, because I feel like 6 minutes wasn't long enough for some people. Some people it was long enough, but we'll just give you 10 minutes. I'm going to play some focus music, and just want you to work on your pitch and just kind of, craft it. And then when we come back, we're going to workshop it. So if there's anyone who wants to share what they've written, that would be the time to do it. And also I want to hear from Kayla to hear some of the really tremendously exciting success that she's had with getting press around the MNEA. So while I find the music, just go ahead and get yourself situated.
And if you have any questions before we start that, you can raise your hand or just turn on your camera and yell at us, because this is a good time to jump in with questions if you have.
Sarah, can I ask a question really fast?
Yes, please.
Okay, so I met with somebody who already co-signed the bill already, but all we got were a half an hour, and there were 22 of us in the room. And so when I spoke, it was like a really simple introduction. Like, how will I be able to get all of this information out? I'm in Los Angeles, so, super small town. But how do I drill it down to get the message across with like 30 seconds?
It's a good question, because particularly when we're doing like these RDLA or Rare Across America meetings, particularly Senate meetings tend to be huge because, everyone in your state who's a rare disease advocate is in these meetings with the senator. The House meetings for just your district are usually smaller and you have more time. I think, in that example, just saying thanks and, I'm going to follow up with more materials for you to send to your Republican colleagues is probably a fine approach. In that case, like, since they were already on the bill, that's great. And all you really need to say is thank you. But, just the ability in those meetings, say, can I get your email address? Or if it's through RDLA, they give you the email address. And just, I think there's a point at the end where Lillian says, follow up, and it's follow up after 2 weeks, and then follow up 2 weeks after that, and then follow up 2 weeks after that. And just, oh, did you have any names we could talk to? Were you able to reach out to those colleagues you mentioned? Can I answer any questions on it? You really, Denise Quealy, who's an advocate in New England, is always talking about the squeaky wheel, and she is right. You have to be the squeaky wheel. So even if you can't be the squeaky wheel in that meeting because there's 40 squeaky wheels, you can do it afterwards. And that's really, keeping those relationships going, particularly once you've met someone face to face, even if it's Zoom, and you have their email address, just continue to reach out to them and sort of continue the drumbeat until you get some sort of response.
Okay. I have no idea what the next one's going to be like, but the next one, she's not already supporting the bill. So I'm hoping that one will be better, a little bit more productive.
Excellent. Well, if you have questions after it, and we'll put this up at the end, but our email addresses, but if you have questions that you get during the meetings, that's the other thing. You don't need to know everything. Like, you'll provide a fact sheet, which we'll email to you. But you don't have to know those numbers of co-sponsors and everything. You just have to tell your story. And then if they come back to you with any questions that you don't know, shoot Lillian or I an email, and we can follow up either with the office or with both of you, however it's easiest for you to do it, whether you want us to directly contact that office and CC you or just feed you data to push back to them, which I often think is the better option, but is more time consuming for your part. Whichever one you want, we're happy to help with.
All right, so I'm gonna start playing some music. And I'm gonna share this little guideline here for creating your story. And I'm gonna set a timer for 9 minutes now. So I want us to start at 1:15 with the workshops. And I'll just be quiet. All right, everybody. Kind of start to come back now. Hopefully that was helpful to just have that time. I want us to dive into workshopping what you guys have created. But first, I would like to invite Kayla to turn her camera on and tell us a bit about your experience recently with getting such incredible coverage of the MNEA and all that you've been doing.
Yeah. So hi guys, I'm joining you from my recliner. So sorry, didn't expect this. So I actually was fortunate enough a while ago. So my son is 2. And I did Rare Across America last year, but their focus was mostly Medical Nutrition Equity Act, whereas kind of where all this started for me. And it's just kind of, it just keeps going. And so I was actually lucky enough or was able to share my story or our story with Lori from Synlogic, who is one of the biochemical companies, Synlogic. And she connected me with their PR people. So they've been working with me and organizing kind of all this for me and kind of sent out little pitches. But like Sarah said, I was, I can very well reach out to some local outlets and get, contacts and share a little pitch. But what I've like noticed is just a little blurb that like kind of hits home, and sending that off to them kind of is really helpful. But yeah, I've done a lot of stuff within Wyoming with different reporters and news outlets. And then I've done a few national ones. And then there's some write-up things that we're doing as well. But most of my stuff is just about the Medical Nutrition Equity Act, but I'm always able to, if I'm given the opportunity to, tie in the formula crisis as well. And like Sarah's little slogan, or whoever came up with supply is not access, is like the greatest. I use it all the time now. So I'm able to still link them together. Everybody knows the formula crisis, but it's also sort of like fading out, right? Like they're not talking about it as much, but they all go, oh my gosh, that's so true. Like, how did that affect you? Like, what does that look like? So you can always tie it back. So yeah, it's been super fun. I've had a lot of fun with it. And then, yeah, I've met with one of our senators so far. And I was actually under the impression it was a no before I started, because one of the reporters reached out to their offices. So I also met with the same representative of hers last year. So I kind of was like, do you remember me? And we were able to just like hit it off. Like Lillian said, like you just kind of become close to them, and you're just a reminder that you're going to be here every year. Or Heidi told me the other day, she sends Christmas cards to them every single year. Just like a reminder to say, hey, but I knew it was kind of a no when I showed up. So Heidi kind of helped me and said, well, why don't you, obviously talk about the Medical Nutrition Equity Act, but then say, state to state coverage is different, and give some examples, and then say, how can you help us at a state level? Because Wyoming has a state mandate, and it doesn't mean anything to me and my family. With PKU, and, you can give them a figure of how many people potentially live in your state, and say, how can you help us at a state level to, get something passed to help the people of Wyoming if we can't do it at a federal level right now. So Cynthia Loomis's office has said that they would prefer to wait for it to come out of committee. So it is what it is. So they gave me some contact information though for some state people now. So now I can keep like the momentum going at the state level when all of this dies down a little bit. And then, they're going to continue to hear about it, from their state people now, and me and the other people that are also, trying to get the Medical Nutrition Equity Act in people's hands. So.
That's awesome, Kayla.
Yeah.
That's really awesome. I know Jennifer says in the comments, have you spoken with Liz? Jennifer keeps tagging her on Twitter.
Liz Cheney, just
yeah.
so everybody is making that connection, is from Wyoming.
Yeah. Woohoo. So I meet with her office in person next Thursday, I think. And just knowing like her history, and she's up for re-election this year, I kind of was like, should I even go? And Heidi's like, yeah, you should go. And she helped me understand that, like, even if Liz Cheney were to co-sponsor it before, the end of this Congress, and if she gets reelected, great. If she doesn't, Heidi said it's still easier to go to that office and say, hey, your office has co-sponsored before. Not that it has to be Liz Cheney again. So everyone's like, you have to go. I'm like, okay, I can do this. I'm going. So I meet with her next Thursday. So if someone you're meeting with is up for re-election, like, just remember, like, it kind of ties to that office then, not just that person necessarily. So.
Amazing. Thank you for sharing that, Kayla. Yeah, it was awesome. I think so. What we'd love to do with the remaining time here is to have a brave soul come forward and workshop your pitch with us. I will say this. It was a slow rolling to get people to volunteer last time. And by the end of it, I had people emailing me that they wanted me to like workshop their piece. So I like sent them written edits, which I'm also happy to do. But I will say though, you might regret it if you don't volunteer now, because there's something to having it live and practicing it live that really is an added benefit. Okay, so if anybody wants to go, just feel free to, this is sort of a everybody chime in when you want to situation. So just jump in there if you want to.
Not everyone at once.
I don't mind trying.
Awesome.
Awesome.
That's really good. Because I like practice more than, yeah. It was really great to have like 10 minutes of go do this now, because it's been on the like to-do list for a while. And then to know that everybody else is at least trying to do it then. So I'm not done, but it's nice to have a bullet list and points and things like that. So do you want to like interrupt point by point or just do the whole thing or?
Do the whole thing.
Okay.
Well,
Hi, my name is Jocelyn. I live in Monroe, Washington. I'm a school bus driver and active in my community. My husband and I just celebrated 16 years of marriage and we're adoptive parents. Today, I want to ask you to co-sponsor the Medical Nutrition Equity Act. I have PKU, and while being on a lifelong diet is challenging, I have been blessed to live a rich and a full life, partly because of the early decision of newborn screenings. Having PKU has not limited me from attending college or traveling abroad, but the biggest challenge to my diet is access to my formula, which is the main source of my nutrition. That's number 4. I don't have this thing in front of me anymore, and I didn't mark it on here. What comes after?
I think it's what would having medical nutrition mean to you?
Oh, right.
I don't have it in front of me either.
Okay. There are so many struggles in navigating healthcare, and I don't pretend to have answers that would know how to solve every issue, but passing the Medical Nutrition Equity Act would be a manageable and concrete steps towards equality, ending hunger within the whatever we're going to call our community that's bigger than PKU, and improving healthcare. This will benefit not just people like myself with PKU, but thousands of other Americans who struggle to access medically necessary nutrition. For me personally, this means being able to go to work and not be hungry. So that's what I have so far.
That's fantastic. Lillian, do you want to? Lillian's the actress, so she gives good tips.
I think that was awesome. And I want to just check in about one thing. You may have that in there and I might have just missed it. Totally possible. But did you say there, I know you mentioned about hunger. Was there another point you made about like what being off diet would mean? Like why it would be?
I haven't, no.
I would recommend
number 3.
I would recommend putting something in there about why the medical foods and formula are so necessary, because something that we've come across a lot in the work we're doing with our lobbying firm is representatives and senators telling them, how is medical food different than regular food? And it's like, they'll explain to them how it's different and they will apparently still ask them that question a few months later. So I think that—
Can you have chicken? So can you have chicken?
Exactly. We know what that feels like, right? Like we know what it feels like to have someone not understand what the PKU diet means and why it's so serious. And so I think if you just add in like a sentence about the ramifications of not having the diet, not having access to the diet, it'll help drive home for them, you know, why it's important people get this treatment.
Got it. Yeah.
And that's also where Lillian has a banana often to demonstrate, you know, newborn screening detected, you know, by like diagnosed with PKU through newborn screening. The diet's very restrictive. You know, a banana is sometimes the limit of what people can have. The rest of our nutrition, as you pointed out, is, you know, this medical food, and without it, these things would ensue. And then you did a great job of saying, you know, your role in the community. I mean, I think that was really important to show, you know, your job and your engagement in the community, and then say, you know, without it, as Lillian said, like these would be the repercussions. But I thought it was a very, very good, and it connected the points. So nice
Yeah, I
work.
thought it was really personal. I love that you said that you were a bus driver. I love that you gave the example of your family. I love how you really personalized it. I think that'll be very powerful for a connection basis. And yeah, I love how positive you were. That's something that is kind of cannot be overstated, to be positive and open and friendly, and you did that beautifully, is so important, because they'll sometimes have people really angry with them, you know, like, why won't you support? And it's like understandable why someone would be angry sometimes, but it doesn't help them listen to you.
Right.
So you did that really beautifully. You're just no notes on delivery. It was great.
Thanks.
Yeah. Thank you for sharing.
And I see Jen, your camera was on. That mean you wanted to talk? You just turned it off though.
Okay.
It's on. I just am not ready. I just wanted to see your faces.
Okay,
In the
cool.
car this whole time till now.
Okay, so two things. Jennifer says, give them some tastes and then they will remember the difference. Yeah, I've heard stories of people like making, you know, the formula right there in front of them and being like, here, taste it. Because that's something also people sometimes wonder, like, well, do you enjoy the formula? And then, you know, it's worth it to tell them, no, it tastes awful. I really don't like drinking it. This is not a treat. I'm trying to get covered. It's like necessary. And then Paul Bremer asks, is there a, hi Paul, by the way, is there a certain length of text that should be adhered to when talking with a senator or representative? My story can be long. I would say if you want to like time yourself, it depends on, like someone was saying earlier, I think it was Kelly, you know, it's challenging if you're in a room full of 22 people, which some of these Rare Across America meetings are, there's a lot of people there. In that case, you want to keep what you're saying down to a minute. So that's like a super condensed version. And so I would practice timing it, and I would practice having a version that's a minute long, which is probably like 2 to 3 sentences. Depending on how fast you speak, I can cram a lot in a minute. And then if it's just you and the person alone, then just, you know, longer is great and fine, whatever it takes to tell your story.
And if you're emailing, we usually say keep it to a page, just because they don't have a ton of time. You know, get those points up front. Maybe like, you know, how Jocelyn gave the example of sort of who she is, what she does, how, you know, how she's related to medical nutrition, why she needs it, what the bill would mean to her in the first paragraph. And then I think go into your story a little more, because often those story points are the spicy, you know, they're the spice that people remember. But, you know, it may be that they're only going to read the beginning of it and put a checkbox under Medical Nutrition Equity Act, because they do keep tallies. And so you want to at least make sure you get that ask in the first paragraph, but then, you know, you do have some time, particularly in a written letter or an email, a chance to sort of, you know, share that personal story that we're really talking about as being the most important part.
Jen, do you want to share? Do you want to workshop?
Or anyone else?
Do I want to workshop? Just because I've done with other people that are not related to PKU or MNEA. There's like a lot of us on the call, and the RDLA person told us that it was like 20 minutes, and there's like 5 different talking points that are unrelated to MNEA. So I think I'm just trying to come up with.
I think we lost you a little bit.
Yeah.
I think we lost her, but she will probably be rejoining shortly. Is there anybody else who would like to go workshop your talk?
I'll go.
Amazing.
All right, this is what I have. Hi, I'm Kelly Baldino. My family lives in Los Angeles. I grew up in the Pacific Palisades right near the Santa Monica Pier and now live in the West San Fernando Valley. I want to ask Diane Feinstein to co-sponsor the Medical Nutrition Equity Act S2013. I have 3 kids, including twins. On day 4 of my twins' life, the newborn screening results came back positive for a rare genetic disorder called phenylketonuria, which limits my son's protein intake to less than 3 grams a day. My son is able to thrive due to formula that provides 90% of his nutrition, as he's unable to get that from food you and I eat. The cost of his medical formula can be comparable to a mortgage payment. Medical food and formula are proven life-saving treatments. However, insurance companies are not required to cover this. Passing the MNEA would solve this problem. It would drastically change my life as his mom and caretaker, but it promises my 4-year-old son the same future his brother and sister have. Thank you from the bottom of my heart for listening to our story, and how can I follow up?
That was awesome. That was awesome. And that's a good example of one you could do even if there were 22 people in the room, because they usually have everyone say hello and like say their name. And I just put in my ask in that because I like what you just did. You can do that easily and that would be great. No one would be mad at you and you would be effective. That was great. No notes.
Okay, awesome. Thank you.
Yeah, as Jennifer Beezer says in the chat, boom, baby. That was great. Nikki says, hi, Nikki. I'll ask, I live in Texas and my reps give the complete blow off. It isn't an issue they're interested in and they refuse meetings. Any advice?
They refused to meet with you entirely? Then I think you should call them out on that publicly about why they refuse to meet with you. I think the thing that I've often found is just when you're talking to representatives or to their staff is asking if they have kids and going in through the newborn screening route. If they don't have kids, there's usually a left turn right there, but generally one of the people you're talking to will have kids, and that you can explain that these disorders are detected through newborn screening, and if you have a child with an inborn error of metabolism, you can explain from that perspective what it means to have that experience, because they may never they may never have the experience of getting a diagnosis. But they all will have the experience of going through newborn screening, and that sort of brings it all, it levels the playing field a bit where you do share an experience, and then you can try and drive out from there. That for those of us who do receive a diagnosis, either as individuals with a disorder or as parents, this is the next step. Newborn screening only detects disorders that we can treat. I mean, there are literally disorders that we do not have treatments for that we could detect through newborn screening, but we don't, because the government has made a decision that it is pretty cruel to say your child has this disorder, but we can't treat it. And so, PKU was the first disorder. I know for Nikki, you're probably not talking about PKU, but you can use it as an example. It was the first disorder to be detected, and we do that because we have a treatment, and that's why UCDs are also on the screening, because we do have a treatment, and this is the treatment.
All right, Paul says, is he the only one in Florida? He'll have to go shortly. Okay. No insurance. You don't have insurance currently, and the state law is discriminatory to patients your age. Yeah, I think no insurance currently. And I think that this bill is specifically regarding getting it covered by insurance. So I would say that if you don't have insurance, if there's I feel like maybe you can email Sarah and I some more specifics about your case, and then we can, kind of communicate with you offline about it. But I think there's a way to, talk about the MNEA and why they should support it using your experience. I'm sure there's a way.
And currently, Medicare and Medicaid do not cover formula for anyone with an IEM. And so that is either people who are aging in or who, have public insurance due to disability. And this bill would change that. So essentially, the public health mandate, the public health system in this country does not support people after a certain age. And we know that this is diet for life. And we know that there are effects if you do not have, medical food as you age. And so I think one really strong, on the federal level, I think that the strongest arguments for this bill are that it would require public insurance to cover it. So it levels the playing field for anyone who does not have private insurance, throughout their lifespan. And then also, I think what Kayla alluded to, and I'm in the same situation, I have a plan that's under ERISA, meaning that it is cannot be regulated by the state. So I actually live in a state where we would get unlimited food and formula coverage, but we do not have a right to it because our plan cannot be regulated by the state of New Jersey. And that's I think the second strongest reason why a federal law is required, because it really, it breaks through those state-based barriers.
Yeah. Hi, Jen.
Hi, sorry, technical difficulties. I was just gonna say, I currently have insurance that covers it, but I did have a self-funded plan when I lived here in Oregon before. And Oregon has great coverage. It covers formula and food as all one umbrella. But I had, like you have, Sarah, the ERISA was making it so that it wasn't covered and we had to pay out of pocket for quite a long time. So I'm kind of planning to use that as one of my points, is like, our state's great, but like, even when I lived in this state, our state law did not help me. So we need it federally. So I think that's hopefully a good point to go towards that might get some action.
I think that's true. And we all, we are these United States. We have the sort of promise, at least, that we can move from state to state where opportunity takes us. And the idea that you could not, take a job in a different state, or, we hear it constantly, like, my kid's thinking of going to college in this state, what's the coverage like here? Because my husband got offered a job, or I got offered a job, and I don't know if we can, afford formula. And so the idea that you are tied to certain states or locked into a certain state because of your coverage, I think does resonate with people. And the idea for states that don't have good coverage, the idea that that's keeping people from moving there and taking advantage of the opportunity, or paying property taxes in that state, or whatever, or voting for these individuals, because the state is known as one that doesn't have good coverage. And Paul, I just want to say, to your point, I think asking that question, I don't know, he said he had to go, and so I may follow up. Oh, you are still on. Asking that question, I'm 56. What is going to happen to me? And just leaving it there. Saying, this is on you. I need you to answer what is going to happen to me, because my doctor has said this is my lifelong medical treatment. I think just asking that question is a really strong way to make that point. That's your spicy.
Completely. Jocelyn, I see your comment. You don't have insurance, but that's because the insurance that you could afford would not cover formula. I look forward to affording insurance and having formula covered, and it won't happen until MNEA is passed. It's true. And insurance companies are not ever going to become generous, because that goes against the whole thing of what they do, sadly. But yeah. I also brought up ERISA this morning, and it was a good point, because I live in New York. It's another state where the coverage is good, but even with it being good, it's still a fight, to get it covered. And then ERISA, it's a loophole. But yeah, if anybody else has a burning desire to workshop their elevator pitch, let us know in the next 30 seconds. Otherwise, I think we'll call it a wrap, but super happy to do at least one more workshopping with someone.
And like Lillian said, we will send out, I think I sent in the reminder today, I sent a link to, you know, a page that has a bunch of resources on it, including the slides from this. But we'll just send that out by email too, just because it's good to have it in your inbox if you need it when you're out and about. And again, that just has the talking points and a few other, you know, links that might be helpful as you move into this. But I don't know if we ever showed our emails. Let's drop them into the chat if you don't have them. Lillian, I never put the right number of L's in yours, so I'm gonna let you do it because
Okay.
you're used to typing your name.
Yeah, my name, I think it's like an optical illusion for some people because there's so many I's and L's all right next to each other.
Yeah.
Yeah, so we've just both put our emails in the chat. Please feel free to, like I said, some people have been emailing us their stories. So definitely feel free to email it to us, and we're happy to give you some notes and edits to help you feel confident and prepared. And yeah, I see everybody's comments. I'm so happy this has been helpful. That's awesome. That's awesome. Thank you so much for coming. And we will be in touch shortly. Have good luck with your advocacy.
Great. Take care.
Bye, everybody.